Okay, well, thank you very much, Rosi. Hi, everyone. It's great to see so many people here. And there's no doubt that 67 years after the formation of the NHS, it faces a critical moment in terms of its future. I think most of us, one way or another, have got a lot to be grateful for about what the NHS has achieved through that time. But I don't think anyone can be in a doubt as we get towards the election that there are some very critical challenges that it has to face up to. I mean, first of all, clearly as the population grows older, we are seeing many more people with complex care needs in one way or another needing help from the NHS. We're also seeing, I mean, there are huge potential advances at the moment going on in health technology, in medicines, particularly individualised medicines and treatments, all of which offer huge potential, but potentially could be very expensive, certainly in the near run. We also have huge inequalities in health and a really worrying increase in disease levels. I think most people now know that if you take Birmingham as a whole, you will see a 10-year difference in life expectancy of boys or girls being born today, depending on which part of the city they live and what their background is. What's also inescapable, when you've got figures like, John may correct me if I'm wrong, but I think it's 24% of young people in Birmingham are obese. School-age kids are obese. And we know that in 20, 30 years' time, they will be presenting to the health and care system with some really serious illnesses. And we know that unless we start to turn this around, we are going to have a system that is just going to fall over because of the likely demands being made upon it. And so just when the NHS is facing all these big issues, when it needed stability and leadership and support, what of course it's had in the last 5 years, is first of all a totally unnecessary but the biggest restructuring it's ever gone through. And alongside it, it's had a funding squeeze. Since 1948, the NHS has had 4% real terms growth on average every year until 2010. And then it's flatlined at about 0.25% real terms growth during this 5-year period. And the pressure on services, the King's Fund estimate, is still going up by 4% a year. So it's had a pretty massive reduction in real terms, alongside swinging cuts in local authorities. And because the biggest discretionary spend a local authority has in adult social care, it's not surprising that adult social care has taken such a hit in its resources. And alongside all of that, the health service has had a huge amount of time taken up, because the 2012 Health and Social Care Act really forced them to tender out services. And up and down the country, clinical commissioning groups have been wasting millions of pounds passing services up, putting them out to tender, some of which have now been won by the private sector. But even where it's not been won by the private sector, there has been a wholesale waste of energy and resources. The result of all this is pretty obvious. I mean, the targets are being missed. The 4-hour A&E target has been missed now for 82 consecutive weeks. The now called the University Hospital of North Midlands has been the worst performer consistently in the last few weeks. It's around 64% A&E target, a massive miss. We know waiting times are going up. There's huge pressure on the system. The closure of NHS directives, replacement by 111, where qualified nurses were replaced by call centre staff, whoever hard they work, inevitably has been pushing more people to A&E. We know, I think, all about the pressures in primary care, the problems in out-of-hours services, and because more people are going to hospital, there are less beds for them. and hospitals are finding it very difficult to discharge patients because social care is not being able to support people who need discharge. No wonder the whole system seems to be falling out. And the Nuffield Trust, which is an independent body that's been commenting on this, concluded about 4 months ago that patients are being forced to wait on trolleys because the pressures mean there aren't beds for them. Improvements in GP consultations have gone backwards. Planned surgery and A&E departments in general, the improvements we've seen over the last 10, 15 years have gone in reverse. And it's getting harder for children and indeed adults to access mental health services. And the King's Fund, which is another independent body, came out with its conclusions on the so-called reforms. I never use the word reforms, I call it the Lansley disaster. They came out last week with their conclusion, and King's Fund kind of always modify their language, but what they said is historians will not be kind to the coalition's government's record on NHS reform. They said they produced an unwieldy structure with leadership fractured between several national bodies, a complex regulatory system, and a strategic vacuum in system leadership at local. In other words, at local level, there is no one responsible for the health system in Birmingham. There are lots of organisations, lots of chief execs, lots of chairs of these organisations, but there's nobody you can finger to say it's your responsibility in terms of Birmingham's health service. And the other thing the King's Fund said is the emphasis on competition has resulted in greater complexity, uncertainty about when contracts should be put out to tender. So when they also said that the percentage of contracts going out to the private sector has remained constant, what they also said is sheerly the effort of having to put services out to tender has been an enormous drain on the health service. If the Conservatives win in 2015, expect more of it. More services we put out to tender, more fragmentation, no leadership, and the system almost working against trying to integrate services. So there is a real choice here. And what we in Labour want to do is to actually go back to 1948 and, if you like, complete the reforms that were started then by combining health and social care into one service, so that a lot of the barriers that we see at the moment, a lot of the perverse incentives that are in place, so that you can have a bizarre situation where the funding formula for Birmingham City Council will give extra money for certain characteristics in the city, whereas the health service will have a different funding formula which will take that money away again. And with each organisation only concerned with their own organisation and their finances, you can often find people arguing over patients because they don't want to pay the cost of care. And all of this detracts from having a proper integrated service where you build it around patients and the public, and where all the professionals concerned actually get their act together and start to provide a much more cohesive service. So we see this as being a health and care system under the leadership of the local authority in the Health and Wellbeing Board, combining budgets and making sure that everyone works to the same cause. Alongside that, nationally, we want the Department of Health and the Department of Community and Local Government to work together, and that will be unique in the history of government. Those two departments actually combining their effort and their resources, so that from the centre they are saying, we want you to bring your services together and we will support you to do that. And finally, we have to have a proactive public health programme. The rising tide of ill health is not sustainable. 12 years ago, Derek Wanless produced a report, and he said that unless we fully engage the public in promoting better health, the system is going to fall over. It's my contention we are beginning to fall over at the moment. And we have to be much stronger about things, particularly in relation to children, about food, sugar and salt in their food. We have to actually be much tougher with the companies about what they do to our food stuff. We have to be much tougher too in relation to things like standardised packaging for tobacco. And we also, and this is something my boss Andy Burnham is passionate about, have to get back to a situation where young people in particular do get opportunities in terms of physical activity to actually encourage them towards better health, both when they're young, but also throughout their life. And so combining health and care, making it integrated, getting rid of this wretched 2012 Health and Social Care Act, getting rid of the enforced privatisation, and putting a lot more effort on improving people's health. That, I think, is the way we need to go forward in the future, and it certainly will form the core of what Labour will offer the public at the election.